This is a special edition of The Big Story with Lloyd Jackson on News Talk 760 WJR. Tonight, Lloyd's special guest, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Call WJR now with your cosmetic surgery questions for Dr. Gray at 800-859-0WJR. Now, here's your host, Lloyd Jackson.
Good evening and welcome to this special edition of The Big Story here on News Talk 760 WJR. Dr. Michael Gray in studio with me, and we will get started momentarily. Are you hoping to feel and look better? Will a more youthful appearance help you in today's tough job market? Well, we've got answers to these and more of your questions because, as I said, Dr. Michael Gray, renowned cosmetic surgeon of the Michigan Cosmetic Surgery Center and Skin Deep Spa, is here in studio. And if you have a question for Dr. Gray, we are asking that you call in about cosmetic surgery or any non-invasive procedures. The number, 800-859-0WJR, 800-859-0957. Let me welcome back here to WJR, the studios in the Golden Tower of the Fisher Building, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Dr. Gray, good to see you again.
It's great to see you. My hours are not complete till I come here.
Well, you know, spring is here, and are you finding that more people are coming to you to enhance their appearance during this season now of reemergence after people come out of hibernation, so to speak, for the winter, and now it's starting to, the weather is breaking?
You know, they come all the time, from everywhere, from all across the world. Father Time is not going to be our friend. You know, everything's changing. And yes, as we show more skin, you know, people want to look a bunch better.
And when you start showing more skin, you start shedding those clothes as it starts getting warmer.
Thank God.
Sometimes, though, you don't really take a look at yourself until it starts getting warmer, and you say, man, you know, what's going on? I need to get a closer look, maybe do some work.
Absolutely. It happens to everybody.
Now, what about the people who come to you who maybe want to get into the job market, who have been out of the job market for a while because of layoffs or whatever, and they have to compete with younger people? They have the experience. They need to compete with younger people, and they want to feel younger, look younger. You see those people coming in as well?
I think facelifts are on the rise, mini facelifts, neck lifts. We also do non-invasive procedures, with lasers that tighten the skin. Of course, everyone wants to look great for themselves and for whoever else they're trying to impress, whether it's in the job market or just, being in the market looking for a spouse or a significant other. But we see a lot of people that are just... It's almost impossible not to store fat. People are doing lipo. You can't diet it away. You cannot. When you diet, it affects the entire body. Usually affects, parts of the body more than others. Typically, it's the face in males that go first. And then a new study came out about 5 months ago. People who diet look old. The reason why they look old is because when you diet, it comes out of your face in males and face and breasts in females. And when you get older, the fat starts to come out of your face. So when you gain it back, you realize what you did wrong. Oh, my God, I lost too much weight. You gain it back. Only a small percentage will return back to the place that you lost it, and it goes somewhere else. Your ass. Mm-hmm. I can say that.
Well, yeah, you can say that's a word you could say. 800-859-0957 is the number if you have a question for Dr. Michael Gray. 800-859-0WJR. Talk about some of the more popular surgeries and treatments that you perform, Dr. Gray.
Well, I perform them all. My training is just a little bit different. I'm a New Yorker. I'm here. I like the state of Michigan. It has a lot to offer. My daughter's in the state, and basically my joke is wherever she goes, I'm going to follow her.
Okay.
Because I like to see her grow up. But, I do all types of procedures. Basically... Not everybody has to have spaghetti with ketchup. You can have it with marinara sauce, meat sauce, fettuccine. What I do is my training enables me to provide all different techniques and styles of surgery for people. I offer different invasive procedures, non-invasive procedures, and people get to choose what they want. But first, they have to be educated. They have to understand what is that what I do, what are the parameters, what decisions they're allowed to make and what they can't make, And the most popular procedure performed is obviously reducing fat. Mm-hmm. And we can do that non-invasively with a brand new laser I want to tell you about called Zerona.
Okay, talk about that.
Basically, if you have a classroom, you're a teacher, and you have a problem child in the classroom, you can go to him, you can scold him. He's quiet. Well, what the Zerona does is the problem children are the fat cells, and there's certain parts of your body that have the fat cells that are disruptive to your body. They just overzealous. They collect a lot of fat, and you have bulges in different parts of the body that are unrelenting, and they are unamenable to diet and exercise. Well, the Zerona empties the fat cells.
Okay.
The fat cell's still there. It still could be a problem, so you have to be very good with what you do. You have to watch what you eat. You have to exercise and be really committed. It doesn't target specific spots in your body. So if you're interested in targeting a specific spot, you can't, Zerona is not really for you. It's more for people with 10 to 40 pounds overweight and general overall fat reduction.
Now, once you use the Zerona and you do that, they have to keep up their part of the bargain as well, though.
Absolutely. Because the problem child, the fat cell is there. You eat wrong, boom, it's back. And that's the first place it's going to go. If you have a spot that you want to reduce, it's like taking out, your sandpaper. You have a spot you want to file down. Mm-hmm. Every profession has their coarse instrument and their fine instrument, and this helps people understand what the difference is between ultrasonic lipo and smart lipo or laser lipo. Ultrasonic is the volume reducer. So if someone has volume, I would opt for the volume reducer.
Okay.
And the fine nail file, it reduces some volume but refines the nail. So laser lipo, the smart lipo MPX, will help tighten skin, smooth cellulite, and reduces some volume. But if you have volume, I want to do the ultrasonic first, then I may hit it with the smart MPX laser. If you just come in with cellulite, we hit it with the laser. If you come in with just some loose skin, the laser helps tighten the skin. We could do it surgically or non-surgically.
How long are these procedures, doctor? I know they vary, but for the most part, Well,
within an hour or two, everything's done, and
mm-hmm.
you're on your goal. When people talk about loose skin, I have to, I listen to the way people talk. Skin doesn't get loose. It's excess skin. So, reducing fat doesn't create extra skin. You have to have excess skin, and you guys call it loose skin, in order to have loose skin. So if we reduce someone's fat, they're not going to get loose skin unless they have skin that's dangling off the body to start with.
800-859-0WJR. 800-859-0957 if you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Ron's on the line. He's holding patiently. Ron, what's your question tonight for Dr. Gray?
Dr. Gray, you were saying that typically as people get older, the fat comes out, or when they lose weight, fat comes out of their face. But my problem is just the opposite. That in my cheeks, the buccal fat is, I could become a skeleton and it would still be fat. And I was wondering if you do like buccal fat pad removal.
Yeah, you can do that. It's with a small little incision inside the mouth over the second incisor. You can just reach in and grab the fat and pluck it out. The danger with that is that the facial nerve courses through that area.
Right. That's what I've heard 1,000 times. So is that highly dangerous or what?
Well, it's not that it's dangerous, but it can lead to paralysis. So you have to be very careful with removing the fat.
Okay, so is that a procedure that you've done or do, or is it not that common because of that issue? It's not
that common because of that issue, but it's a procedure I've done. I'd have to first look at it. A lot of times what we do is we just lipo over the cheek, and we don't go after that buccal fat pad. That fat pad is deep underneath your cheekbone. So often we can remove the fat that's just underlying the skin safely.
And get the same result, or pretty
different results, but results that are people quite satisfied with.
Okay. All right. Well, thank you.
Ron, thank you for your call. 800-859-0WJR. 800-859-0957. Dr. Gray, when you talk to your patients, when your patient comes in, a person comes in and wants to get a procedure done, when they tell you what they want done, you guys have a consultation. This is a consultation where you listen to that person and that person listens to you. It's not like, well, this is what's going to happen and this is where it has to be.
Right. No, there are doctors out there that do that. I shy away from that. What I do is I try to figure out. So the problem with my profession, it's so secretive. It's like David Copperfield writing a book about what he does. Believe me, you guys cannot read about what I do. There's some information out there, but the heart of what I do is so secretive, we're not going to write books about it. So a lot of people have off-the-wall ideas about what it is that I'm actually doing, and they don't really understand what it is they want. I have to first figure out what it is they're trying to say to me. Okay, that's a big hurdle right there.
Okay.
After I try to understand what it is that they want and they don't want, then I have to explain to them all the procedures that I can offer them and figure out how they want to go about achieving their goals. So it's not just you come in and you want breasts enlarged, all right, or a breast lift. I have to figure out what it is you're really saying to me, because a lot of people come and they just grab their abdomen. I don't want this. Okay. Well, I don't know what this means.
Right.
Is it the muscle that's bothering you because it's protuberant, but you don't have any extra skin or fat? And, then I could do a tummy tuck, but I'm not going after the skin. I'm not going after the fat. I'm actually going after that muscle. Mm-hmm. Okay? Mm-hmm. And to make room for babies, a lot of women have this problem where the abdominal muscles stick out. But in women's culture, female culture, they secretively are taught to hold their muscles in. Now, for me to hold my muscles in, it's a lot of work. So I wouldn't think that women do this, but I know women do this, and they do this all the time, and men don't think they do it, but they do it. And there are a group of women who don't feel that it's work. They just do it subconsciously. They
Right.
just hold it all the time. That's a woman who doesn't care about their muscles. Right? Mm-hmm. Then there's women who, like men, we consider it work. And for women out there, when guys hold their tummies in is when we're walking to our chase lounge at the pool. Once we get there, we let it go. So don't look at us till we get to the chase lounge, and you'll see what our tummy really looks like. But anyway, so women who consider it work may want their muscles tightened or flattened. And to gain access, I'd have to do the tummy tuck. But I'm not doing the tuck really for the skin. It's just to access the muscle. So when you mess with muscle, that's when it's a little bit more tender than if you didn't mess with muscle. And people think what I do is, quote, surgery. It's really procedures. When the public thinks of surgery, they're thinking C-sections and open heart surgery.
And cutting.
And you hear people say, oh, you're addicted to cosmetic surgery. No one's addicted to cosmetic surgery. They're just not fearful of it. It's like driving on a highway when you first get your license, you're in the driver's ed car, mm-hmm. and, you're so scared you drive onto the shoulder. Well, I drive on the highway all the time, but I'm not addicted to it. It's just I'm not scared of it.
Right.
So what happens is once people experience what I do, they realize that it's not what they thought. And I hear that all the time. Well, I also hear people say, wish I did this 20 years ago. Because what happens, because it's elective surgery, people actually think they can fix their own problems. They can't. So skin doesn't hurt at all. You touch the cut, don't touch the cut, it's fine. So anytime you hear the word lift and tuck, it means I'm trimming skin. But if I always use the word lift, I confuse the public. So when you have extra skin hanging over the lid of your eye, and if I called it an eye lift, people think I'm lifting their eyeball up. So we call it eye tuck. So tucks and lifts, sometimes I want you to know that you're being lifted. So we call it breast lift, face lift, neck lift, butt lift. But then we call it tummy tuck, arm tuck, thigh tuck. When the tuck involves the muscle, it's more tender. So when we do the tummies without muscle, it's not tender, mm-hmm. right? So people who have a lot of pain with tummy tucks, it's due to the muscle.
And what about recovery time?
Well, it depends. Like if there is restrictions more than necessary recovery on what I do. If I do the upper lids, it's no more than a paper cut. I tell you don't rub the upper lid because I don't want you to bust my stitches. But there's no pain involved with it. When I do a facelift, lifestyle lift is a facelift, guys. So when I tell people to do a facelift, I tell them, plan a week, and they probably need less than a week. But they have restrictions on their activity for 3 weeks. I just don't want them being overzealous in the gym or things like that. But they're out in public within a week. Neck lift, 3 days. Tummy tuck, you can be sitting at your desk in a week.